Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Hey everyone, welcome to Research Perch. My name is Michael Reynolds. I'm the co-chair of the marketing committee for the Massage Therapy Foundation, and we're so glad you've joined us. Here as always with Nikki Monk and Ruth Werner to discuss journals from the International Journal of Therapeutic Massage and Bodywork, which is at ijtmb.org. And that's where we take the articles on the journal and kind of unpack them for our listeners and help them get a better handle on the world of research and massage therapy. So Nikki, joining us from your office in Indianapolis today. How are you?
Hey, doing great. Thanks, Michael.
Great. I'm also in Indianapolis, so you and I know the weather is improving steadily here in Indy. We're seeing the sunshine at last. So
lovely.
Happy about that. And Ruth, how are you?
Fabulous, well into spring, and it looks like it's going to start raining again here in a minute, which is exactly as it should be.
Excellent. Glad all is well on the lovely coast of Oregon. All right, so today we are pulling out a journal from a bit further back. It's a 2012 article here, and the topic today is massage therapy produces short-term improvements in balance, neurological, and cardiovascular measures in older persons. And this is a good one. Some of the background on this before we jump in and get started. Kind of the abstract starts out with a statement that kind of helps us understand what's going on here. It says, falls are the primary cause of accidental death in older persons, producing increased morbidity, decreased independence, and billions in medical costs annually. And it goes on to say that massage therapy may produce adaptations that decrease the risk of falling, and if massage therapy can improve stability in older persons, it may provide a new intervention for this issue. So this is a great topic today, don't you think?
Oh, absolutely.
So, Nikki, why don't you, do you mind starting us off and kind of telling us what happened? Kind of say what study is this, what happened, how they set things up, and kind of walk us through it if you don't mind.
Sure. So I'm going to do a couple of things, actually. So I'm going to first introduce the primary investigator of the study. This is Joellen Sefton. And this is a woman who several years ago was awarded one of the Massage Therapy Foundation's grant awards. She's an awardee, and this was one of the studies. This is the study that came out of that. Is that accurate, Ruth?
Oh golly, I know that Joellen does volunteer work with the foundation, but I am not immediately aware of whether this project was.
Well, I'm going to say that it is because it actually has it in the acknowledgments. So,
in the acknowledgments, I have my notes on this article, but not the download. So, all right, so great. So this is one of our grantees. Awesome.
Okay. So this is one of our grantees, and this is actually a two-part paper. So the paper that you introduced, Michael, is the short-term effects of the study design, which we'll talk about in just a minute. And then they did a paper right after that. In fact, it came right up on the heels where this one leaves off at IJTMB in the same issue, the next one. And this is going to be the 6 weeks of massage therapy produces changes in balance, neurological, cardiovascular measures in older persons. And so what this does is this is speaking to one of the things that we see in practice, right? What is, if I do one massage session with somebody, what are going to be, if you will, the acute effects, okay?
Short term.
Right.
Most measurable. Right.
Good. And but then we have this thing that we do in our practice that is essentially cumulative effects, right? And this idea that if somebody receives massage over time, if one session is good, surely with the law of facilitation being what it is, right? And we get our bodies start integrating the work more and they hold the work longer and longer and longer, that any kind of benefits are going to be elevated after multiple sessions, okay? And so that's the design that they put together really speaks to that. So they do a pre-post, before and after the first massage session, and then they do the massage session once a week for 6 weeks, and then they do it again pre-post and see what the differences are. So that's the first thing that I want to introduce is one, the primary investigator here, Dr. Sefton, and then also the very massage field and practice reflectiveness of the study design. And now let's shift gears and start looking at the population, which is older persons, and then the condition, which is going to be falls risk, and the piece that we're measuring, and that's going to be the posture stability. So Ruth, with your piece in pathology, how about you talk a little bit about that and set us up?
Well, I can talk about this a bit, but I do want for our listeners to know that Nikki came into the study of massage therapy by way of gerontology, I believe.
That's true.
So
That's what my doctorate is in. Yes, is in older adults.
Yeah. So really, this is just right up your street, which is fantastic. But as Michael said, the case for why this is an interesting and important study is very strong, which is that, you know, we have an aging population. There are more people who are over 65 than ever before, and the primary cause of accidental death is falls, and the factors in falling have to do with gait and balance disorders, interactions with medications and interactions between medications, lack of physical activity, cardiovascular disease, neurologic disease, and, you know, all of these things work together to make people, especially elders, more vulnerable to the really serious complication of falling. And once someone has fallen, I don't have the stats right smack in my head, but when we look at the statistics for someone who is recovering from, you know, what we call a broken hip, which is actually usually a broken femur, where the head of the femur snaps in one way or another, and makes a person become bedridden, then the risk of death from pneumonia or from other complications goes right through the roof. And the ability or the chance of someone to regain full function is increasingly lower and lower with age. And so what do we do with this information? Well, we look at what can be done to prevent the risk of falling. And there are whole fields of research about how can we, you know, help our elders not fall. You're doing that again.
Yes, Dr. Jett, Dr. Allen, they are big fall people in the fall world in gerontology, yes.
Right, exactly right. So the idea here was that evidence suggests that massage therapy might help with balance, and the research team had a thought that when we look at, you know, for instance, what happens immediately post-treatment, we might see some instability, as we see people are sometimes a little bit woozy or a little bit dizzy right when they get off the table. But the hope was that then stability would improve, not only, you know, with the time after a single session, but over time as people, as you say, you know, get more and more skilled at receiving the benefits of massage. We see that other interventions like exercise and yoga have been seen to help with this, and so the question was, would massage therapy also help with balance confidence? So in the first study, we were looking at what we call the acute effects of massage, which is what we can see immediately post-session, and they had some really interesting ways of measuring balance that I'd love for you to speak to, because you're I'm sure much more well versed in this than I am. And they had some surprises in their findings.
Mm-hmm. Well, so there's a couple of pieces. Let's back up a little bit and we'll talk about the population that they did the study on. Mm-hmm. And so they did do a randomized trial design, and the participants, they were looking for to certainly get older individuals in, but they were specifically recruiting 50 to 69-year-olds. So this is a slight limitation in the study in that the fall risk really does get bigger with older adults, right? Not just people who happen to be older than others.
Some of us on this call might fall into that parameter, for instance.
Right. And so, but one of some of the exclusion pieces that they're looking at, because when you're doing research, right, you've got to be able to point to as much causative pieces as you can, especially when you're doing control trials. And so to be able to say that they don't have any other conditions that might be influence postural balance and things like that. And so you had to have no chronic diseases that affected balance. The cardiovascular health was good, or any nervous system pieces, or conditions that affect functional decline, or things like this, medications. They did have some exclusion criteria for that, and having done my dissertation research on older adults, and one of my exclusion criteria was medications that affected any kind of muscle work. Well, that's all blood pressure medications.
Yep.
And so while I had all of these people who were very interested in participating in my research, as soon as I asked them, are you on beta blockers? Well, yeah, which a really large portion of them are. Yeah. That affects muscle function, and when you're trying to measure muscle function, You don't want to have that as a confounder, especially in the early stage studies like this. So this was an explanatory study, is one of the things that they were looking at doing. So they did recruit these folks. They ended up getting a pretty balanced design. They had, oh, you know what? I don't know off the top of my head how many people went in each group, but it was a pretty even distributed group. They had both men and women.
They had 35 participants, 19 men, 16 women, with a mean age of 62.9 years, plus or minus 4.6.
Yep.
I wrote it down.
Yeah, so pretty young overall. And in this, I don't recall how many people were in each group, but well, it was a balanced split that went there. And the measurements that they were using, they were measuring cardiovascular pieces. They've done this in the past, and so they were looking at
blood pressure, right?
Heart rate and blood pressure. They were looking at that, and then they were also doing measures of balance. And basically, there's several different. They have this really super cool machine that essentially, when you stand on it, it's really sensitive with where the pressure is being distributed, and it can tell how shaky somebody is, for lack of a better term. That's real layman's term. How shaky somebody is and how balanced they are. And so they have them do several different things. They have them do standing with both of their feet flat on the ground with their eyes open, and then they do a little shifting of the platform and see how they handle that. And then they do it with their eyes closed, so now you don't have the visual cues, and then they do the little shifting and they measure that. And then they have them do one leg stand and not putting their foot down while they measure it, and then they have you close your eyes and do that. And so, I mean, that's hard for, it's hard for me. But anyway, so those were the ways that they were measuring balance. But then they were also looking at motoneural pool excitability. Mm-hmm. And so basically, what are the neurological pieces that go along with this, right? And so what's happening that's triggering the muscles to do the balance and the stabilizing pieces, what's happening before the synapse goes and what happens after. And so what they did was they did measurements on the soleus muscle. They put the little electrodes on there, and they measured these pieces. And you know what? That's as far as I'm going to get with that, because that is so outside of my wheelhouse, being a psychosocial research-trained person. But I think that gets the big gists of it. So these are the pieces that they were measuring. So now we've got our cardiovascular piece, our balance measures, and then this motor neural pool excitability. Okay. Now let's talk about the design of the study. So before we start getting into the short-term, long-term effects, both of these papers are talking about the same study. Mm-hmm. And basically what they did was they had people come in the first time, and they did repeated measures every time they were doing their measures. So week 1, they came in, those who were in the massage group versus those who were in the relaxation room. So instead of going and getting a massage, they went and sat quietly in a relaxation room. So that was the control group, okay? Right. And before they got the massage or the relaxation room, they were tested. They had all these measures taken, okay? And
so
then
for baseline.
Except for what?
For baselines.
Right, yes, for baseline. So
that's baselines, right?
So that's pre-treatment, right? And then they had their either massage session or session of relaxation. And then immediately after that, they were tested again for a majority of the pieces. So that was for the cardiovascular and the balance, okay? Those two pieces were done immediately after. And then with the hypothesis that immediately after the session, we're going to have these sorts of outcomes. But then after a little bit of time of recovery from the session, those things are going to change. And so they did the measures again at 20 minutes post-massage. And then they did them again at 60 minutes post-massage. And at that 60 minutes post-massage, they also did the nervous system measures again. So they didn't do the nervous system right after the massage, and they didn't do it at the 20 minutes after. They did it at the 60 minutes after, okay? So this was day 1, test day 1. And in fact, it's what happened in that day that the first paper talks about only, okay? But for the rest of the study design, now we have an additional 6 weeks that the massage group, as far as I can tell, they actually don't, there's a little bit of missing reporting in here. The massage group, we know, returned and just had the massage treatments for 5 more weeks after that. Mm-hmm. I don't know what happened to the control group, whether they came in and still sat in their quiet room or not, because it doesn't, besides the fact, it doesn't say. But then on on week 6, they come back again, and the massage group, both groups get measured before the massage session starts, and then immediately after, either massage or the rest room, the room within which they were resting, not anyway. Not the bathroom.
The resting room.
Yeah, the resting room, and then 20 minutes after, and then again 60 minutes after, okay? And so this is the big pieces that they're talking about in that second paper. Now, also in that second paper, they did another week after that, week 7, which now there's no treatment, but now they're just coming in and doing additional measures. So to see essentially without another massage intervention what effects might be. And they just did one measure. They just did another measure to see if there was anything holding. The suggestion that perhaps massage effects, especially cumulative effects, might not be as measurable immediately following a massage session, and so let's give it a little bit of time. And they actually had some interesting findings, but we'll get to the results here in just a minute. But that's a lot of information, but that is the essence of what the study did. That's a breakdown of the methodology, and then they did several different analysis pieces that we could get into, and it makes everybody's eyes glaze over. But essentially, what they did a different kind of analysis than perhaps I would have done. They didn't do a repeated measures design necessarily. What they did was they looked at the treatment session that they were interested in. So for the acute effects, they looked at that treatment session 1 and the different times that they measured there. But then for the cumulative effects, they just looked at that session 6, what was happening there. They controlled for baseline pieces, but they didn't necessarily do a repeated measures piece and then do secondary data analysis.
But what about the testing at week 7?
So the testing at week 7, they were only comparing to week 6.
Okay.
But there again, they still included baseline. They were controlling for baseline pieces in the model, but they didn't necessarily do from week 1 to week 6 to week 7, which would be a repeated measures design with the change pieces. So, but that's a
yeah, you're getting into some fine points about research design that I think a lot of us are not going to connect with until we become more literate. So.
Yeah. So I'll be quiet for this one. It might just be, and truly, it might be a difference of personal preference. And what they're doing with their work is they're building a case for the research program that they're doing where they are, and that's different than some of the research programs that I'm doing and others are doing.
Yeah, it's not an issue of validity particularly so much as purposing what we're looking at, how the research wants to be used, right?
Yes.
So if we go now to the first paper, which really sets the stage for everything, which is just on the acute effects of massage. In other words, the measures after week 1, and we look at the results and the discussion. And
I do want to clarify something. It's at week 1. It's not after week 1. And I think
it's after post massage.
Post massage, yeah, and it is the first. It's that one single session. I think that's one of the things that is a little confusing in the paper is that they talk about it as week 1 when they haven't already established this larger study context.
Right.
But we'll just know that that's the time point that they're measuring at. Yeah.
Okay. So what do we see? What I wrote down from my reading is that there were no differences immediately post-intervention. In other words, they were expecting to see some teetering or some instability post-intervention, but they didn't see that as a clinically significant thing. Did you come to that same conclusion? But that there were significant group differences looking that suggest increased stability over time for the massage therapy group.
Yes. So, and over time being at
20 minutes.
Oh, 20 minutes, 60 minutes. Right, right. And so I think the big thing to focus on here is we have to be really careful giving massage therapy to older adults, especially if we think that it's going to reduce their fall risk, because when people get up from massage, their stability is really woozy, and that's no good. And so this is sort of a thing that's out there, right? Well, their findings are showing that immediately following massage, the stability piece wasn't any different than the control group.
Right.
Which, while they weren't necessarily powered to find non-differences and non-effects with this design, it does suggest that, you know, and in fact they even talk about it rather cautiously. You know, this is hopeful, saying that actually this may not, our evidence doesn't support this piece of information.
This idea or this prediction that people are going to be pottery when they get up. That's not giving free license to not be concerned about it. But
and they even say, you know, there's still pieces. I mean, it's basically saying that given the precautions that we're already doing with folks getting up off the massage table and the knowing that, you know, there can be blood pressure drops, that seems to be okay based on this. And so absolutely understand what the medication pieces are and those sorts of things, but that their evidence doesn't necessarily support the contraindication of providing massage with those auspices. Yeah.
At least, you know, compared to rest. Right.
Yeah. Yeah.
Good. And then we also saw that in these acute effects of massage or massage after a single session, that for the massage group there was less postural movement with the in other words the two-legged stance, or the what's the word? What's the difference for the one-legged and the two-legged balance test?
Oh gosh, you know, you can just sort of put those all together in one, because one of the things that they found out too is that the single leg test, nobody did well on that. It's a really hard test to do. And so
there were no significant differences between the massage group and the rest group.
Yeah.
But there were for the two-legged balance test.
Mm-hmm. Eyes open, eyes closed. Mm-hmm.
Right, and that the massage group did better. And the last thing I wrote down here was that in terms of the motoneuron pool excitability, they suggest that possibly there's a decrease in recruitment post-massage, in other words, suggesting that posture and postural adjustments become more efficient. So they did see a change in the amount of motoneuron activity post-massage with increased stability. So it wasn't like decreased activity and they fell down or they were more teetery. It was decreased stability decreased muscular activity with increased stability. And so the theory, the hypothesis that they derive from this is that possibly massage is modulating this excitability and helping their postural adjustments to be more efficient.
Right. And because of that efficiency, now the muscles don't have to work as hard. They're working more effectively and efficiently and not having to recruit all this extra help to keep people stable, right?
Well, and to me, what that speaks to is the occasional gift that you get when you get up from a massage table and you feel like you've been infused with 6 hours of sleep. Have you ever had that?
Yes.
You know, it doesn't happen for me very often. But once in a while, I get a kind of massage where I get up off the table and I feel so much. Instead of feeling like, oh, I want to go take a hot shower and a nap, I feel like, oh, I want to go for a long walk, right? Because I just feel like everything is so much lighter and so much more efficient, if you like. And that's the sensation that I associate with a finding like that.
Well, so one of the things that's happening with this finding as well is that they're not testing this causality piece, right? In fact, they do these correlations to see if there's a connection between these outcomes, okay? So that if they were to do a testing piece down the line, then the next thing to do would actually be to test now the postural pieces too. So in addition to the balance stability, is their posture more erect? Are their muscles working more efficiently and effectively and standing up on top of each other? Because that's not something that's being measured. They are hypothesizing from the way that the neurons are being recruited, right? Or the activity is happening, and the fact that they have better postural control. So like I said before, for their purposes and what's the next steps in their research. And you know, I've not talked to JoEllen about her research program, but I sort of suspect that those are the sorts of things that we're going to be seeing coming out of her lab.
I hope so. I find this
posture pieces but she's they're doing a really nice job of setting up the story of why is it that massage might be effective here. Okay, so this is the thing that we're going to test first. And these are the pieces they've identified, sort of the drawbacks to doing massage on this population. Now, granted, these are younger folks that might be considered older adults, but establish it in this population first before you then start going and looking at all manner of older adults, right?
Populations with more confounds, more possible confounds.
Exactly.
Yeah, exactly. But it's a nice way into the whole mechanism question.
Yes, absolutely. Yeah.
A lot on Research Perch about the difference between looking for efficacy, does it work, and mechanism, how does it work? And what we're finding here, which I hadn't realized until you just talked me through this, is that this is a really nice setup to start asking questions about mechanism.
Yes.
So that's, yeah, and it's not just for elders. I mean, if we want to talk about massage helping us move more efficiently, there's data here that, could lead us in the direction that could be supported.
Yeah, everyone can learn to move more efficiently.
Yeah.
Helpful to everybody. So I admit I did get a little bit lost in some of the fine details of research, but I'm lazy, so I jump to the end and look at the outcome of massage does have a stabilizing effect, and that's great. That's good news. So, I'm the lazy person that jumps to the end of the book. So, I think we're probably close to wrapping up. Anything else?
Well,
yeah, go ahead, Nikki. Go ahead.
So that's for the short-term piece. So now we can jump over to the results from the long-term piece. No?
Yeah. No?
Well, I think we're short on time today.
Okay.
So.
Oh, okay. So we've set ourselves up then for a brief discussion.
Yes. Why don't we cover that next time? Would that be okay? Okay, great.
Okay.
That's great. So tune in for sure to hear the end of the next chapter.
We'll definitely cover that next time. So we'll be sure and post a link to the article as well on the blog as we post this episode. And so if you're watching, just click below and look for the link there. And if you're listening, you can do a search by obviously the author name, Sefton, or any of the keywords, and find it on ijtmb.org, which we hope you subscribe to. So just a quick refresher on what ijtmb.org is. Ruth, do you want to just kind of give us maybe the 10-second background on IJTMB just for our listeners who may just be joining us?
Yeah, I'd love to do that. The International Journal of Therapeutic Massage and Bodywork is this profession's only academic peer-reviewed journal specifically for massage therapists. It is published only in electronic format. It is completely open sourced. It is free to use. You're absolutely welcome to download, make copies, share it around, just tell people where you got your information. And a unique thing about the journal is it's not only free to use, it is free for authors to submit to. So we've been reading a lot lately, those of us who pay attention to this, about scientists and people who are doing studies really being kind of ripped off by journals of ill repute who are willing to review their articles for a small fee. We don't charge a fee to anybody to use the journal, to submit to the journal. It's one of the most important and most impactful projects that the Massage Therapy Foundation does. I really encourage all of our listeners to pop right online to ijtmb.org and subscribe to the journal. What this means is once a quarter you will get an update. You'll get an email saying the new edition of the journal is here. And that's the sum total of what it means to subscribe to the journal. But it's important for us to know who's reading it, what our distribution is. We have a tremendous worldwide distribution of readers. We want you to add to that. Plus, which when we have subscribers, it improves the way the journal is listed in various kinds of databases. And it improves it increases the number of people who are willing to share their science with us. So it's very important, if you're a user of the journal, please to subscribe.
Great, thank you, Ruth.
And to do just a really quick thing too is Ruth said that it's for massage therapists. It's for massage therapy, but not just for massage therapists.
Right. Thank you. Anyone involved? So that's also anyone involved in manual therapy will find things useful here, and anyone who works with massage therapists or who's curious about what massage therapy can do for your patients, you'll find great information here at the journal.
Yeah, absolutely. Yeah, so that's where these articles come from. So that's what Research Perch is all about, is unpacking those that content from IJTMB. So thank you very much. So Great discussion today. Thank you both, as always, for discussing this one, and thank you so much for everyone who joined us today for the episode. So, as always, you can go to massagetherapyfoundation.org to find us online. That's the MTF website. And again, ijtmb.org is the journal. So we encourage you to subscribe to our blog, subscribe to the journal, and keep on listening to Research Perch. So Ruth, Nikki, thank you so much for today. And thanks everyone for joining us. We will see you next time.
Bye, Michael.
Okay.
Thank you for joining us for this episode of Research Perch. Please send feedback or questions to perch@massagetherapyfoundation.org. See you next time.